This presentation is about the classic theory of Tidal model and contemporary theory of self-care deficit and how it can be applied to a nursing scenario. The Tidal model. It is focused on helping people to recover their voice to begin to express something of the meaning of their lives, which is the first step towards helping people take control of their lives over mental distress. The core concepts of Tidal models are that it is based on personal stories and of service users. It is a holistic model of care. It promotes self-management and recovery. It is based on caring rather than caring for, and it promotes the concept of therapeutic experience rather than containment. Dr. Phil Barker and Poppy Buchanan Barker introduced the Tidal model theory. Dr. Phil started his career in healthcare as a nursing assistant in the late 1960s and afterwards became a mental health nurse. In 1980, Poppy was a social worker for young people affected by physical and mental disabilities, while Dr. Phil was a psychotherapist, professor at University of Newcastle, and nursing supervisor. He also started his doctoral studies about hospitalized women with manic depression. After receiving a PhD in psychiatric nursing, he became the first psychiatric nursing professor in University of Newcastle and taught at a number of international universities and was active in community support groups for mental health until he retired in 2002. The six assumptions of Tidal models are belief in the virtue of curiosity, recognition of the power of resourcefulness rather than focusing on problems, deficit, or weakness, respect for the person's wishes rather than being paternalistic, acceptance of the paradox of crisis as opportunity, acknowledging that all goals must belong to the person, and virtue of pursuing elegance. The 10 values are value the voice, respect the language, develop genuine curiosity, become the apprentice, use available toolkit, craft a step beyond, give the gift of time, reveal personal wisdom, know that change is constant, and be transparent. Now let's move on to self-care deficit. It is a combination of three interrelated theories: self-care, self-care deficit, and nursing system. Dorothea Orem received multiple honorary doctorate degrees and awards due to her contribution and achievements in nursing. Her grand theory, self-care deficit, is one of the widely known and frequently practiced nursing theory. The core concept of this theory is self-care, therapeutic self-care demand, self-care agency, self-care deficit, nursing agency, nursing system, and basic conditioning factors. The assumptions are people are assumed to be self-reliant, responsible for their personal care and anyone else in their family who may be in need of care. Each person is a distinct individual. Nursing should be considered a form of action because it is an interaction between two or more people. One of the most important components of prevention and the removal of ill health at the primary care level is to successfully meet developmental and universal self-care requests. The knowledge in individuals is about their potential health issues is a necessary component of any self-care behaviors they may be able to implement. Self-care and dependent care are both learned behaviors within the context of social, cultural, economic. Meet Allie. Allie is a 20-year-old female with a history of depression. She is accompanied by her mother at the outpatient department due to depression. Allie is a full-time college student taking general science. During weekends, she works as a host in her family's restaurant. Her mother noticed she had been missing classes, losing weight, staying in her room mostly, and struggling being a host in a family restaurant. Allie reports she recently broke up with her boyfriend of 2 years due to infidelity, and she finds school overwhelming. She also expressed that she does not plan to harm herself or others. The nurse encourages Allie to speak and express her concerns. Allie speaks and the nurse actively listens. The nurse and Allie developed a plan to meet every day that week and reevaluate the frequency of their meeting afterwards. Allie will also join group sessions offered in the center and to keep a daily journal to write how she feels and thinks, to express her voice using her own language. The nurse informed Allie on different coping mechanisms to overcome her emotional distress. The nurse also encouraged Allie's mother to be involved to monitor and assist. The application of the Tidal model. Taking the time to talk to Allie, participating in session, and trying different coping mechanisms such as keeping a journal are examples that are valued in Tidal model. Encouraging her to set a goal and timeline will empower and help her improve her sense of self worth and identify her strengths and weaknesses. She can also claim ownership of her goals, which is an important concept of Tidal model. Let's not forget the 10 commitments of Tidal model, which we have discussed earlier. In assessing Allie, the nurse asked open ended questions and listened actively. The nurse questions are: how did the problems begin? How did it affect you? How did you feel? How did things change over time? How are your relationships affected? How do you feel? What do you think it all means? What does that say about you as a person? What needs to happen now? What do you hope the nursing team will do for you? Who is important to you and why? What is important to you? What is your personal philosophy? How will you know the problem has been solved? What needs to change for this to happen? And what will be different about you? What will other people experience? In the application of self-care deficit theory, the nurse is facilitating Allie to be independent by caring for herself through keeping a daily journal, attending an outpatient appointment, and setting a goal. Encouraging Allie to express herself and tell her story inform the nurse of the resistance and barriers to self-care, thus assist in developing a tailored intervention. Session with the nurse, group therapy, and involvement of her family create a supportive and safe environment for Allie to self-reflect, share emotions, be heard, feel safe, and socialize. Using the SCDNT nursing assessment, the nurse will evaluate Allie's profile, universal self-care requisites, developmental self-care requisites, past health deviation self-care requisites, present health deviation, and self-care requisites. In conclusion, the self-care deficit and Tidal model have many similarities and differences. Both promote client-centered care and patient independence, encourage client empowerment to restore autonomy in health promotion and illness prevention, improve quality of life and health, and provide nurses a framework in formulating evidence-based and patient-centered care plans that produce outcomes that promotes healing and health. In contrast, self-care deficit is generally applicable to client population while Tidal model is focused for the promotion of mental health. Tidal model encourages Allie to express herself by sharing her stories, thoughts, and emotions using her own language. On the other hand, self-care deficit lacks recognition on the emotional needs of Allie and is limited in recognizing individualized factors such as physical or mental deficits that may incapacitate Allie to participate in self-care. Their similarities show the validity of the theories regarding patient care, while their differences provide nurses the advantage of diverse ideas and approaches. This is crucial when dealing with different issues and impact of illness. Thank you.